Time now for Views from the Hill with WBCB News Director Rick Rickman. Join Rick each Thursday as he brings you local lawmakers and leaders from Magnolia Hill in Levittown. Now here's your host, Rick Rickman.
Good afternoon and welcome to The Hill. I'm Rick and you're listening to Views from the Hill, and I am pleased to say that I have two very, very special guests today. One of whom I met about a year ago under special circumstances, and we'll be talking about that throughout the hour. And we're all just rushing into the studio after the news and still getting set up here. So I want to give a warm welcome to Nicholas, Amy, and Debbie from Bucks. Sorry, we're still getting set up. From Bucks NAMI, the National Alliance on Mental Illness. I think I got that right.
Yes, you did.
So thank you so much, guys, for coming in. Today's it's a special show in my book, and I wanna really say thanks for coming on. So I hope the ride-in wasn't too bad. I know you guys are out in Warrington, but it's hopefully a little closer for you. So
well, yeah, no, not at all.
Welcome
Thanks
to
for having
BCB.
us. Thank you. It's great to be here.
So today's show is going to be about a couple of different things. We'll probably get into some of the more serious stuff as it goes on. But I just want to start out with some of the more lighthearted stuff. Sure. So we were just in the lobby. We were talking about NAMI Man and the, some of the things that go on there. And there's really not anything too lighthearted about any of this. But when you find good, you cherish it, and I guess I should kind of preface what we're going to be talking about today.
Sure.
And so I met you, Nicholas, back last May, I believe it was.
Yes. At
Bucks County Technical High School for the Suicide Prevention Walk.
Yes.
And it was, to say the least, a very emotional experience for a lot of people.
Yes, it was.
And you were a speaker there. I don't know if you want to just tell us briefly what, obviously I saw you, but if you could just give everyone a rundown of what that was like for you.
Sure. And please call me Nick.
Sure thing.
Yeah. So the Hold On You Matter walk is where we met. And first of all, I really appreciate you having me. Not everyone would have someone else talk about mental health. And what I spoke about at the walk and what we'll talk about today is mental health and suicide. And I work for NAMI Bucks County because I myself live with a mental health condition. And that day I specifically spoke about surviving the 3 suicide attempts that I survived, and why I appreciate this and the Hold On You Matter walk. And NAMI has a walk to end mental health stigma in May, on May 16th, is because when I was at my lowest in depression and anxiety, and I'm diagnosed with schizoaffective disorder, you don't think that there is anybody else out there who's ever been through what you're going through. And, suicide is a pain that I wouldn't wish on anybody. And thoughts of it, that's a pain I don't wish on anybody. And, we exist to, help to support people with that, educate people, and to advocate for better lives for people like me who live with mental illness and our families. So,
Thank you, Nick. I really appreciate coming on and being so open about this. I think that's, and we'll talk about it as we go on. But I think that that's step one.
Sure.
Is kind of being transparent with a lot of this stuff. So
absolutely.
Thank you so much. Before we get into some more of it, I just want to say welcome to Debbie. Thank you so much for coming on.
For having us.
If you could just tell us a little bit about who you are, and you're also at NAMI, but if you could just give a brief introduction.
Yes. My name is Debbie Moritz. I'm the executive director for NAMI Bucks County, and I am a family member of several people with mental illnesses that were developed in childhood. So I've spent a lot of time working with them and trying to help them become the best person that they can be. And this is my passion, and that's why I'm here.
All right. And I guess, we'll just start it out. And, do you think that, to me, it's kind of like I guess, a paradox, right? Where, 1 in 5 Pennsylvanians, I think, is the number right now, where that's how many people are affected with a mental illness. And you would think that, you've got family, Debbie, Nick, you're a survivor yourself. I myself have my own experiences and friends with their own experiences. And I would think that this would be something, it seems to be like more common than cancer. And yet it's not talked about as much. And one thing that we'll be talking about today is the Reach Out PA initiative that the Governor Tom Wolf has advocated for, and they've just released a report around that. And yet it's not talked about a lot. And to me, that's because it's just hard to talk about. Maybe some people don't want to deal with it. What are your thoughts on that, Nick?
Well, I think everyone, I don't think, I know everyone has mental health. If you have a brain, you have mental health. And what I think is difficult about it are a few things. That you're not born with knowledge on how to maintain good mental health or what to do if anything goes wrong. And your mental health can range day by day. It's a good mental health day. It's a bad mental health day. You don't have to have a mental illness to have challenges with your mental health. But there's a stigma associated with mental health that says you should be stronger, you should man up, you should, just take charge of your life and do what you need to do. And if you just work harder or more or, just do a little better, then you won't have depression. And if you just man up, you won't have anxiety, things like that. But I know for a fact, having lived through it, and there's evidence to prove otherwise, that you can't just work harder and get rid of depression without some kind of an intervention. And people don't seek help for that because they're just afraid to say anything in fear of someone else judging them as weak or inferior or less capable. And like I said, everything that I'm saying is a lot from personal experience. It's what I've been through. So
yeah, and I hope that we'll be able to talk about the importance of personal experience.
Oh yeah,
today,
absolutely.
Now I said we'll start it out with something a little more positive, and I kind of didn't hold true to that, but
that's okay.
But I want to circle back to NAMI Man and
sure,
and being a superhero, but also kind of being a normal guy kind of thing. So. If you could just, maybe we could talk to NAMI Man. You told me in the hall it's just you, but with a slightly deeper voice.
Okay, well, if I can let everyone in on a secret, yeah. So, sure, we can introduce everybody to NAMI Man. Fear not, NAMI Man is here. So, right, NAMI Man is just me, and I was telling you a story, and I'll share it with your listeners that. NAMI Man is the one and only mental health superhero, and he exists, and his superpower is to crush stigma, and stigma is the main barrier to treatment. But NAMI Man, as I was telling you, visits hospitals and inpatient units and declares schools and places stigma-free. But I had the pleasure of visiting Horsham Clinic in the children's unit, and I don't mind telling you because it's a great story. I go in as NAMI Man, and NAMI Man is a green costume. Green is the color of mental health awareness, and I go in costume and with a cape and a mask and everything. And I let them know, because I myself was a patient at Horsham Clinic at one point, that what makes me a superhero is that I lived through the things that I thought that I couldn't live through. And surviving 3 suicide attempts, I did. I made it through.
It's powerful.
Then, yeah, well, I'm trying to pass it on. But the superheroes are real people. And then I take off my mask, and I kneel down with them, and I tell them that, I was a patient here, and I'm proud of you for doing this. And, you too are superheroes for getting the treatment that you need, and being brave. And being brave isn't just sucking it up or being tougher or working harder. Being brave is asking for help when you need it. And I think the world of those little kids, and then I have them draw themselves as superheroes. And it was a really cool day. It really was. And
when was this? How long ago was this?
When did I go to Horsham Clinic? About, I would say a month and a half ago.
Okay.
I'll be going once a quarter to visit, and with the adolescent unit there, I went as Nick and told my story, and then they requested to meet NAMI Man. So I went and introduced them to NAMI Man too.
Now, Debbie is the one you came up with NAMI Man. You were telling me in the lobby
Yes,
a short little story about that. Could you tell our listeners how
we
that came
were
about?
participating in a NAMI walk, and we were always wanted to have a superhero and a princess there for the kids to kind of engage them. And we were having a hard time finding somebody to be a superhero. And I thought, well, why don't we just make our own? I mean, we're all superheroes that live through this. So we just took a costume and put our grassroots symbol on it and NAMI Man and added a mask and a cape, and we even have boots now. And
Wow.
Nick
boots.
took off with it
Yep.
and gave, like you said, gave NAMI Man a personality.
Yeah,
Nice.
well,
So,
I mean, I think that it's difficult to know that recovery is possible and that you can get through any kind of a mental health challenge if you don't know that anyone else has done it. And humor is healthy, and it's one of the principles at NAMI that humor is healthy. And it's not making light of mental health or mental illness. It's just that if we went to the office every day and answered the helpline and were serious all day long, that would affect our mental health. And so, I mean, there's humor in everything, and if we can see the humor in it, it's healthy and it helps the recovery process.
I like that. That's a very positive message.
Yeah.
All right. So I do have an obligation to do a couple of commercials.
Sure.
So we'll be right back with more Views from the Hill. I'm pleased to be joined by Nick and Debbie from NAMI, the National Alliance on Mental Illness, the Bucks County chapter. We'll be right back after these words.
We now return to Views from the Hill. Once again, here's your host, WBCB News Director, Rick Rickman.
Thank you, Merrill Reese, for the introduction, and I'm happy to say we're back to Views from the Hill at Magnolia Hill in Levittown, and I'm joined by Nick, Amy, and Debbie from NAMI, the National Alliance on Mental Illness. Great to have you guys. I'm really pleased that you were able to make it today. So we were just talking about some, keeping it lighthearted and talking to kids about some of this stuff, and you, in Horsham, you were speaking to some younger people, and there are. If you have read the news at all in Bucks County in the past few days, you'll probably know of a story from just a couple of days ago in Bensalem, where a young girl, I think she's turning 14 today, is her birthday is today, and her name is Caitlin, and she practically saved her friend's life, is what it came down to. So
She did.
As a brief synopsis of this, she was 13 at the time. They'd just come back from winter break, and a friend came up to her and said, I'm contemplating taking my own life. I don't know the exact words. None of us really do.
Right.
But she had marks on her arms indicating self-harm, and then there was a social media post later on in the day that was also worrying. And so, a few steps later and a few details later, Caitlin reached out to police after trying to get to her friend and alerted authorities that there was something wrong. And they arrived to this young girl's house to find her in the midst of trying to take her own life. And they saved her, and she's now doing okay. What are your thoughts on that? So, just immediate reaction. What was?
I have so many thoughts. I'm so proud of Caitlin, and if she's listening, I'm proud of you. If she ever hears this, I hope she does. I'm so proud of you. Snyder Middle is one of the schools that we've been to present a program called Ending the Silence, which is NAMI's early intervention mental health awareness suicide prevention program, where I'm a speaker for that program, and we go in and we talk to kids about mental health, the importance of it, what the signs of mental illness and suicide are, and then what exactly to do if yourself or someone you know is struggling with thoughts of suicide or threatens an attempt or anything like that. And I think it's important that Caitlin know that she did save her friend's life. That's absolutely, you saved someone's life. That thoughts of suicide are never really a joke or a cry for attention. Talking about suicide, it's never a joke. But that to always take that seriously, and that's exactly what Caitlin did, alerting the authorities. And I mean, it's a scary place to be in. I know when I was going through suicidal thoughts and was thinking about an attempt, I made sure that no one knew. I made sure that, you know, I wasn't going to be a burden on my family, and so, you know, telling anybody would have ruined that. But to be as you know, astute as Caitlin was in seeing those signs and taking them seriously is what, you know, any suicide prevention program aims to do, is to let kids, especially youth, know that it's serious.
Yeah.
Yeah.
And I think you're right on the mark. Especially because, like you said, people who are serious about being suicidal, like I know that, you know, the kids these days sometimes joke about it a little bit more than maybe they should.
Right.
And I think one thing to know is that oftentimes it's the people who don't say anything, and maybe they'll make like one remark or something, is when and that's kind of when you know something is wrong. Like, because there are people who will joke about it, and I think there is actually something there.
Oh yeah.
But it is the quiet ones, they say, you know, who try to mask it. And you know, obviously, you know, being, you know, as young as she is, it's amazing that she stepped in.
It is.
One thing that she did, though, was she specifically credited. I don't, if it was you who was at that middle school that day that she was in class, she credited the people who came in to talk about suicide prevention as the people who helped her stay calm, and you know, it was nerve-wracking. She said that was the word that she, you know, word she used, but she said that she was able to think back to that talk in school, and it was specifically that that allowed her to kind of collect herself and step in. Well,
she's a hero. So however it happened, we just provide a service, and it's up to these kids. And see, when I was a kid, I didn't want to be called a kid. So it's up to these young people.
That's fair.
To really take it and listen and then use it. And we do lots of things in the program to make it memorable. But it's really her. I mean, the credit can't go to anybody else, and it was lovely of her to give credit to. But I don't. I think it's her. She's a hero.
Great.
NAMI Man's a hero, but she's a real hero.
Yeah. So this actually segues us nicely into something that just came out 2 days ago, and this was the Pennsylvania statewide suicide prevention task force report, and this started back in like 2019, I think was when they started their study. They interviewed 800 people. And they just asked them questions about, I believe they actually asked them 3 specific questions, if I can find them. But it was about, you know, what challenges are you facing in your community, about stigma and suicide awareness, and then also how can you strengthen a safety net for individuals, and then how can you better support survivors. And they collected all these responses, and they put out an initial report. And this is apparently part of a 4-year plan in the state of Pennsylvania to help, prevent suicide and all that. So I saw that NAMI was actually mentioned in this article. What role does NAMI play in producing something like this, or helping, you know, what input was there?
Well, first of all, I want to congratulate Governor Wolf for this initiative. There's also, Mental Health Matters in PA. What is it exactly called?
It's like Reach Out PA. Yeah.
Your mental health matters. Now, any of this information is not a lot of it is new to those of us who work at NAMI, but why it is huge is that we come across people every day at NAMI who don't know things like what stigma is, that it's a barrier to treatment, that, even what kinds of mental health treatment are available. We have a helpline that's busy all day, every day, from 9 a.m. to 9 p.m. because people it's not readily available knowledge that the things that we outline in these initiatives are issues. So NAMI will be a partner to Governor Wolf in this, and our state organization, NAMI Keystone Pennsylvania, which exists to support affiliates like Bucks County, Montgomery County, Philadelphia, everything like that, to partner in this. And NAMI Keystone actually helped to facilitate the listening sessions where we gathered the data that said, there are barriers to treatment. We need support for survivors. We need, fair and easy access to the treatment that we need when we figure out that we need it. Because it's difficult to come to terms with the fact that you probably have a mental health condition that requires some sort of intervention. So it's different for different people.
I've seen people in the midst of being diagnosed, where they're talking to a nurse, and the nurse is telling them, or the doctor is telling them, listen, you've got bipolar disorder, and you need medication. And they say, no, I've got ADHD. I'm just a little bit disorganized right now, and then seeing them like a couple of days later where they've accepted it, and it's hard enough to come to terms with something like that, and I think this is kind of keeping it up on the support side, where once someone has gone through the difficult process of recognizing that they need help, there should be that help on the other side, that other arm that's reaching out for them when they reach out. So
think of it in these terms. So imagine your life is just, gradually and then completely disturbed by what seems to be your own brain launching an attack on you. Yeah. And it's scary, and you're trying to fight it, and you can't. And then you decide, okay, I need help. And then you ask for it, and you realize that your insurance doesn't cover it, or you can't afford it, or there's not a provider near you that accepts your insurance. Or that, your family doesn't support you through this process, or that you lose your job, or there is no vocational help for you. That's everything that's in these reports, and that's everything, and why I'm so happy that this is happening, these initiatives and the statewide task force, because it's something that I've lived through, that people with mental health conditions live through, and for it to be acknowledged statewide like this I think it's great. I think that hopefully it'll be longer than a 4-year initiative. Hopefully it's, because there will be generations that come after that need to hear this too, and need for it to be an initiative. But I think the 4 years, like because government is so slow. I know. So it's like it's 4 years of coming up with the plan. I think they want to. I think that the idea is they want to do it right. Right. Oh yeah. So on that note, I think we've got a lot to get into, because this is a juicy document, and there's a lot of good stuff in here. Yes, there is. From doing a brief read through of it. So I'm going to take a quick break. Sure. We'll be right back with more views from the Hill and a little bit more NAMI.
Tune in every Wednesday during flyer season for...
We now return to Views from the Hill. Once again, here's your host, WBCB News Director, Rick Rickman.
Thank you, Meryl, and thank you to Nick and Debbie for coming in today to talk about mental health and stigma and the many, many issues that surround this. And I also want to give a thank you to the Pennsylvania Suicide Prevention Task Force, because they are the ones who kind of, well, not just kind of, they created the report and they did the study, and so we're going to be talking about this for a little bit and what the conclusions are in here, because I know, speaking from experience, as someone who doesn't like to read too many state reports on different investigations and initiatives.
They're not that bad.
They're not that bad, though.
No,
and I was really pleased by what I saw in here.
Yeah.
So if anyone's got a little bit of morbid curiosity, go flip through it. It's not hard to find. It's the Pennsylvania Department of Human Services. I'm sure it's up on their website right now.
It is. And it's on Governor Wolf's website.
Good.
Yep.
Good. Because this should be front and center. Like this is a huge breakthrough. I don't know. I can't compare it to other states. I don't know what other states have done on something similar to this, but I know that this is a big step.
Yeah.
Especially in Pennsylvania.
Yeah.
I mean, it's just it's pretty great. So I went through. I did the classic student thing.
You highlighted.
I highlighted things. Yes. So I got my yellow highlighter out and I flipped through it and I thought, this kind of seems important and that kind of seems important and hopefully I was right, because otherwise I'm going to be bringing up silly things. But I know you've got a copy in front of you. Are there any basic general thoughts that you have about it before we get into the nitty gritty?
From so the statewide suicide prevention task force came first, and there were listening sessions first, and that's where a lot of this came from. I think what we need to acknowledge is that what Governor Wolf did with the opioid epidemic or crisis is and should be applauded, and that's what he's trying to do with mental health. From the NAMI standpoint, we find that a lot of people who are dealing with whatever you want to call it, the disease of addiction, substance use disorders, that there's a lot of times a co-occurring mental health issue.
Right.
So this is a natural progression, and to say that we're excited about this is an understatement, because this is our thing. But the Suicide Prevention Task Force statewide, we have a local task force.
Yes.
The Bucks County
yeah.
Suicide Prevention Task Force, and we work with them directly, and they fund some of our programs like Alternatives to Suicide, which I'll talk about. But this initiative came from that and listening to people. And so what you see in the report, if you don't feel like reading it, and it's also on the NAMI Bucks County social media,
Good.
is and the quote that I love is that Governor Wolf said, "For those struggling with their mental health, we have one message: your mental health matters, and it's okay to reach out for help," which is what NAMI that could be something that we said. I'm so proud that he said that, and that they're stepping up their efforts. Now, how you can view this report is that we're stepping up our efforts in every place that someone might enter the system. So mental health care access. So what we just talked about
Right.
before, that if you figure out that you are struggling, that you have a point of entry that's reliable and you can stay with it.
Will that now? There's a lot of ways that can manifest. In terms of where the initiative is attacking, is that does it go as far as changing laws surrounding private health insurance companies to ensure that certain things are covered, or is it the state will provide something? What exactly might we see in the future?
Both, and I think it's important to know that it's not forcing anyone to do anything at first. It's a collaboration.
Okay.
So, everything works best when we all work together and want things to happen. So, but they're going to work with insurance companies because there's not parity. So, meaning that mental health is treated and covered like any physical health issue. So, making sure that anyone who is paying for health coverage has adequate mental health coverage, and that it's sustainable, and that
Yeah, I often hear a comparison between, breaking a bone and finding out that you have to cover, maybe you have to take medication for a certain disorder or something, because at the end of the day, it's not like just because it's mental, it doesn't exist. I think that's the biggest thing that a lot of people have trouble with. Is, and this is from personal experience, is that if I can't see it, it's not real.
Or you can wish it away or hope it away or just wait long enough until it just goes away. But it doesn't. Just because we can't see mental health doesn't mean that it doesn't deserve equal coverage and fair treatment. And that this also means that when someone enters the system and has some sort of coverage, that as they're progressing through their treatment, that there's no gaps, they're not dropped, things like that. Because as I am someone who takes mental health medication, and I can tell you, and since today we're talking about suicide also, that mental health medication, antipsychotics, antidepressants, anti-anxiety meds are life-sustaining medications, just like, insulin for diabetes and inhalers for asthma or whatever else you need to stay alive for a physical health issue.
And speaking as someone who's obviously intimate with this, one of the things that is laid out in the introduction of this report is using the experiences of survivors, families, of survivors, families of people who have lost people to suicide. Is there anything more valuable that you could use as input for this?
I don't know how, since psychiatry depends largely on someone being able to verbalize the ongoings in their head as best they can, how you can have a fair and adequate system or initiative or program if you don't talk to the people who are receiving services, who have been through these struggles, who have survived attempts and losses, to know what works best. NAMI itself values greatly lived experience. In fact, as employees of NAMI, no one really works at NAMI unless you have lived experience, and we value that over other experiences that you might have, like professional or otherwise. But I think a lot of people listening might know that that's a fundamental, but not everyone does. But for the state and for the governor to recognize that is huge.
Yeah,
it's huge.
Because I have to admit, a lot of the things in this report I was reading, and I'm probably more familiar with this than the Joe on the street, just because of friends and personal experiences that have required great attention to detail. But when it comes to a lot of the things in this, I mean, obviously once you get more to specific and everything, that's something I didn't think of or something. But overall, it seems like a lot of it is things that, like you said before, NAMI just knew. A lot of people who have lived this already knew. And the important step is that now it's being recognized officially.
Yeah. I think it's also important to recognize how, if you're listening and you live in Bucks County, that we have a wonderful Department of Mental Health in Bucks County who works closely with us, who values our opinion, who does wonderful things to fund unique and innovative programs. But for the governor to recognize it is huge. Now, in this report, it talks about the integration of physical and behavioral or mental health. I prefer the term mental health because my diagnosis is not based on my behaviors only.
I've heard behavior and mental thrown around. Is there? I'm not honestly sure. Is there a difference? Well, is it subtle?
Includes the substance use side of it, and or some other struggles that you might have related to your brain health. Okay. So the ongoings of the brain is covered in behavioral health. Now, I do think that a lot of substance use is a mental health issue as well.
I'd agree with that, yeah.
Yeah, so I just prefer mental health.
Fair enough.
And we do have a Department of Behavioral Health, too, that oversees a lot in Bucks County. It's but now, in this report, integrating physical and behavioral health. Now, what I think is really awesome in Bucks County is the way that we've approached mental health care and the unique programs that we do have and are able to provide. And this is many counties across the state, but I'll speak for Bucks County. Unique programs like peer support specialists, which are other people with lived experiences helping to guide you through what really usually is a difficult time, and it's hard to really know the ins and outs of the system on your own. But we're able to do things because we have funding that was carved out of a larger budget, intended to really give the individual what they need in terms of care and mental health care. And Bucks County has been doing an awesome job with that. And part of that is to fund the programs that we do. So we do 35 support groups across Bucks County. And we're one of the points of access into this system.
Sure.
Now, when you're integrating physical and behavioral health, I think that's a great approach to it. I think we do so mindfully, knowing that, yes, some mental health meds cause you to gain weight and cause you to, it's happened to me.
So, I've heard some other maybe side effects you can't talk about on air.
Yeah, definitely. That happens, and it's definitely important to, in order for you to go into a mental health facility, like a psychiatric inpatient program, you have to be medically cleared. So you can't do one without the other. Now, I think the way that we approach this, and how I do believe that this initiative is outlined, is that we keep funding local in the counties for those unique and innovative programs, while keeping in mind that it is all tied together. Mental health is health.
Yeah.
So.
I like what you said, especially at the end there, where you're talking about keeping it local. I'm a strong believer in local incubation, I guess is one way of putting it, where it's kind of like I learned in a political science class. The state legislature is the incubator for democracy, where it's like each state will do their own thing because at a federal level it's like there's one way to do things, right? But each state has its own pathway, and by everyone trying to experiment on their own, you find out, hey, that's something that Idaho, Iowa, one state, whatever. Idaho comes up with something that Iowa didn't think of, right? And I think that's kind of what you can expect from the NAMI of Bucks County versus the NAMI of Chester County or something.
Yeah,
where
there's different needs.
There's different people, there's different needs. Obviously, Philadelphia has, I would assume, especially with places like Kensington, where it's just almost a behavioral nightmare, I guess, is one way you could put it, where there's just so many people that need help.
It's sad,
and there's a different approach that you need there than you might need in Upper Bucks County or something. It's not to say that they don't need help as well. And there's not, obviously this is cross everything, whether it's race, gender, class, or income status. If you've got a diagnosis, you've got a diagnosis. It doesn't matter, what job you hold. So I like that you bring that up.
Yeah, I mean, something that you can rest assured about is that we have first we have an awesome mental health administrator in Bucks County, and the staff that works in the Department of Mental Health and Developmental Programs. But then, we also have commissioners who have, like Diane Marseglia, who has been for years fighting for things like this and supporting, mental health initiatives and mental health all around. When it seems that now it's in the fore, but even before that. And I think we're lucky, and we can hit the ground running with an initiative like this because we've already started.
Perfect.
Yeah.
All right. Well, oh my goodness, look at the time. So I got to take another quick break. When we come back, I want to talk about really quickly upcoming things with NAMI, and maybe I know that May 16th there's something coming up, and maybe we can talk about that really quick. So you're listening to Views from the Hill. I'm pleased to be joined by Nick, Amy, and Debbie from NAMI, and we'll be right back after these words.
Hi, this is Dr. Lee Piccarello inviting you to tune in.
We now return to Views from the Hill. Once again, here's your host, WBCB News Director, Rick Rickman.
Thank you very much, Merrill Reese. And we got a couple of minutes here. I'm joined by Nick, Amy, and Debbie from NAMI, the National Alliance of Mental Illness, the Bucks County chapter. Thank you again for coming on, guys.
Thank you.
We've been talking a lot about suicide prevention and stigma and mental health in general. I know on May 16th there's something special coming up.
Yep.
If we just want to look ahead to the future of certain things that are going on in the future, I don't know if we want to jump right to that or if there's something coming before that you wanted to talk about. I don't know. Go ahead.
A lot of our events in Bucks County that as a team, NAMI Bucks County is planning, align with the initiative that Governor Wolf set forth. Things like, early intervention for children and youth as far as mental health goes. We have Ending the Silence going into schools, and that's been a long-standing program. Yesterday and tonight, we roll out our youth support group program for youth ages 12 to 17 who are struggling with their mental health or just might be having difficulties and need to talk about how life is hard sometimes. That's absolutely true.
That's rolling out tonight?
We have one tonight at our office in Warrington, 1432 Easton Road in Warrington Green, Suite 2D. Anyone is welcome to any of our groups, any of our programs. They're all free of charge. And we provide the support, education, and advocacy, and we can help to guide you to treatment if you need it. But we're just a safe place. Any of our groups are just safe places. So youth support group starts tonight and runs concurrently with a parent support group. So we'll have the youth in one room and the parents in another room, and we can all talk about life and mental health. Then we also have veterans and first responders are a priority. Veterans are definitely a priority for NAMI, and we have a program called NAMI Homefront, which helps to educate family members and loved ones how best to support a veteran. And then for first responders, we have a first responder mental health film series.
What's that called?
Beneath the Vest.
Okay.
We'll have that at Del Val University on Monday, May 11th. And it's 8 short films about first responders and first responder trainers, Michelle Monzo from Montgomery County, who have struggled with their own mental health and sought treatment and come through on the other side. And it's difficult because NAMI has a program called CIT, Crisis Intervention, where we work, Lenape Valley and the county really spearhead that program, that they have trouble talking about their own mental health. They have to respond to mental health crises every day. They have to see things that people don't normally see on a daily basis, and then they're expected to just go home and have dinner with their significant others or take their kids to the zoo or whatever and not feel the effects. But
I've talked to State Rep Frank Ferry. He's a firefighter about that a few times, and the things that he's told me, both on the air and off, have been eye-opening. I do have to say, though, we've got only a few seconds.
Sure. And the Stride for Mental Health Awareness.
Yes. So May 16th, where will that be? In
Warminster Community Park in the Special Events entrance on Bristol Road. It's from 1 to 4 p.m., May 16th. It's a Saturday.
Perfect.
Yep.
Nick, thank you so much for joining me.
Thanks for having me.
I think it was a wonderful conversation. I really appreciate you wanting to be so open about not only your experiences, but what you think would be helpful for Bucks and what NAMI is doing. Debbie, I want to say personally thank you for joining us, being our emotional support. And, it's just, this is an important one for me, based on, I think, a lot of people's lives. This is something that touches a lot of people, but not a lot of people talk about. And I wanted to give us an opportunity to talk about it not only in public, but on the airwaves in a public forum. So hopefully one person listening to this got something out of it.
Hope so, too.
Hopefully more.
Yep.
So with that, I'm Rick Rickman. Thank you to Nick, Amy, and Debbie again. I so greatly appreciate this.
Thank you.
It's very important to me. And with that, I'll be back next Thursday with State Senator Steve Sanacero for whatever the future may hold, and also for tomorrow's news.